There is much consideration being given to legalizing marijuana. Many would like to have marijuana, also known as cannabis, legalized for medicinal uses. Within the United States, there are 14 states where it is legal to use cannabis for medicinal use. There is no reason why marijuana needs to be legalized in the smoked form, as there is an alternative drug that is safer, also known as Dronabinol, or brand name Marinol. I will present to you 3 reasons why. Dronabinol does not present the same risk. There is a way to control the dosage. The DEA helped promote the study of Marinol. According to research, marijuana has been shown to help patients who are suffering with AIDS, cancer, and leukemia. The drug is said to help relieve nausea, vomiting, and pain. Marijuana is a Schedule I drug. According to the DEA, a Schedule I drug means that the drug is unable to be prescribed, has the potential for abuse, not currently acceptable for medicinal use, and lacks safety of the drug. There has been a considerable push to have the drug moved to a Schedule II. The difference between a Schedule I and a Schedule II is that the drug would now be able to be prescribed. The DEA has declared that marijuana is highly addictive, and because of its psychotic reasons, it's not a drug that should be put on the market. And again, there is a safer alternative, also known as Dronabinol. Dronabinol is in the cannabinoids family. The main active ingredient is a synthetic THC, also known as delta-9 tetrahydrocannabinol. THC controls the area of the brain that affects vomiting, nausea, and appetite. Although Dronabinol has addictive qualities, it must be taken daily. It is only a Schedule III drug. Marijuana has several known and unknown factors. Short-term consumption of marijuana has been known to cause short-term memory loss, hallucinations, impaired or lost memory, and impaired cognitive skills, to name a few. Marijuana contains more than 400 different chemicals, many of which also is in tobacco cigarettes. Long-term use has been shown to cause cancer and problems with breathing. It may also affect the sex and growth hormones. Because Dronabinol has been tested and used in a pill form, it does not present the same risk. As with all medications, there are possible side effects. However, at this time, it has shown very little risk for the development of cancer and/or breathing problems. The most serious possible complications from the drug, as listed on the warning, is seizures and fast breathing, or fast heart beating. Because Dronabinol is in a pill form, it is easier to control the consumption. As with all possible, and the dosage can be controlled. Never in history has any drug been approved for medicinal use in a smoked form, such as what is being legislated for marijuana. The problem is there is no way to know how much is safe, or how much of a chemical is contained in each leaf or stash. With Dronabinol, the medication is only available in a pill form at this time. The drug is made the same way each and every time with the same chemicals. So the patient is always receiving the same dosage with each use. Again, as it is in a pill form, the DEA can follow the drug and see how much is being consumed by a patient. The risk of possible overdose is lower as there is a prescribed amount to be taken at daily intervals, and there is consideration to a person's weight and size. There is no way with smoked marijuana to set limits such as these. The DEA has continued to work with groups to study the effects of marijuana. To present, very little data has supported any benefits. What is not commonly known is the DEA actually helped facilitate the research and study of Marinol. According to an article presented in Justice.gov, the National Cancer Institute approached the DEA in the early 1980s regarding their study of THCs in relieving nausea and vomiting. As a result, the DEA facilitated the registration and provided regulatory support and guidance for the study. Marinol has been both approved by the Drug Enforcement Agency as well as the Food and Drug Enforcement Agency. Again, with such a safe alternative to smoked marijuana, there really isn't a need for it to be legalized. I am sure as research continues, there will be more alternative drugs available in the future. Thank you.